A bump on the head may look minor, but some head injuries can become life-threatening. How do you know when it's an emergency?
Call for emergency help. Call emergency medical services immediately if the person 1. Loses consciousness, even briefly. 2. Has repeated vomiting. 3. Becomes increasingly drowsy, confused, or difficult to wake. 4. Has a seizure. 5. Develops a severe or worsening headache. 6. Has weakness, numbness, slurred speech, or difficulty walking. 7. Has unequal pupils or vision problems. 8. Has blood or clear fluid coming from the nose or ears. Remember, after a serious impact. Treat the injury as serious after a high-impact event, such as a road crash, fall from a height, or powerful blow to the head. If a neck or spinal injury is possible, do not move the person unless there is immediate danger.
What to do? Keep the person still and calm. If there is bleeding from a minor scalp wound, apply gentle pressure with clean gauze. But do not press directly on a suspected skull fracture or a soft, sunken area of the skull. For swelling, a cold pack wrapped in cloth may be applied gently for short periods. Watch for delayed symptoms. Important, symptoms may appear hours or even later after the injury. Watch for worsening headache, vomiting, confusion, unusual behavior, increasing sleepiness, or problems with balance or speech.
Remember, head injuries can be deceptive. If symptoms are severe, worsening, or the person is not acting normally, seek emergency medical help immediately. When in doubt, treat a serious head injury as an emergency.